Welcome to the Aesthetics Injector Gang podcast. Having a gang of mentors in this industry has been a blessing that we wanted to share with you. Our core group has been traveling together and comparing notes about life and business for years. Tune in as we delve into topics with others in the industry that you are sure to love and make you laugh.
Hey everybody, welcome to another episode of the Aesthetics Injector Gang podcast. It's me, Valerie. I'm going to be your host this week. Today we are joined with the fabulous Jessica McCarry. She's a very accomplished physician associate here in St. Petersburg. She is with Gayoso Plastic Surgery and Med Spa here in sunny St. Pete. I've had a girl crush on her for a while. She knows about that already, and I told her. But I trained with her a long time ago, probably back in 2021 at a small med spa I was practicing at. And I had previously had a terrible training with someone who kind of beat me down and made me feel like I was not really going to be a good injector or ever, make it in this world. And then I trained with Jessica, and honestly, she was just like sunshine and beauty, which is her old Instagram handle. But she just brought like a completely different atmosphere to the training. Really was just open, very enthusiastic, supportive, very great to be with her. She is an AMI trainer as well. She's very accomplished, like I said before, and she recently has made partner with her plastic surgeons at Gayoso. So huge accomplishment for her. I'm not really sure how many people are partnering out there right now with their physicians, but I really just wanted to bring her on here and kind of hear her story and get to know her a little bit more. So Jess, if you want to introduce yourself to everyone and say hi.
Oh my goodness, what an introduction. Thank you so much. I feel like I'm at my wedding right now and you're my maid of honor. Hi everyone, I am Jessica McCarry, however you see fit. I am a PA at St. Petersburg, Florida. I work at Gayoso Plastic Surgery and Surgery Center. I have been with them for almost 8 years now, which is kind of wild to say. But I've been an AMI trainer for about 6 years now as well, and kind of do a little bit of everything, anything non-surgical. As far as injectables go, lasers, threads, you name it, I'm here for it. But I'm just really honored to be here. I think this is such a great podcast, and I love the initiative of it. So I'm ready to rock.
All right, awesome. We have a lot to unpack in 30 minutes, guys. So really strap on your boots, get your beverages together, because we have just a lot to talk about. So I think first, Jess, I just kind of want to hear your side of how you got into aesthetics, because I actually don't know this about you. I'm really curious how you ended up into aesthetics to begin with.
So I was going throughout PA school, and I knew I really wanted to get into maybe dermatology or aesthetics of some sort. But interestingly enough, when I started PA school, 10, 11 years ago, nobody really talked about aesthetics. I was like the one and only person that was really interested in the aesthetic field. Orthopedics was really big at the time. ER was really big at the time. Dermatology was starting to get a little bit more interesting to some. And I literally made it well known that this is where I wanted to be. And so during every rotation, every networking event, everything, every parent of a student I would talk to, I'm like, I want to work in aesthetics and I want to work in aesthetics. And finally, a friend of mine's dad was like, you know what? I know of a plastic surgeon. I'm going to give him a call for you and see if maybe he'll take you on as a student. So sure enough, called him. Dr. Gayoso had never had a PA student before, ever. And out of the goodness of his heart, decided to do a charitable act and take me in for 6 weeks. During that time, he grilled me with questions. And the whole time I'm like, this is an interview. He's interviewing me. Sure enough, at the end of the rotation, pulled me aside, was like, what do you think about this? How do you like the plastic surgery world? I was like, oh my God, I'm in love. If this is what I could do forever, this is it. He was like, great. Well, one thing we learned is that we really enjoy having students, and we'll probably add on more. Good luck to you. I went home. Yeah.
No.
I went home. Yes, I was like, oh my God, this is it. It's never going to work. I thought it was going to happen. I cried. Sure enough, like a few days later, I sent him an email just like, listen, this is really where I want to be. So if you ever would consider having a physician assistant, like I want to be your girl. So resent my resume, all that kind of stuff. And sure enough, the next week they called me and offered me the job. But it was really the first 2.5 years was more of a first assist position. So I was working in surgery, which honestly to me was probably one of the best experiences I could have asked for. We did anything from full face surgery, facial reconstruction, full body cosmetic surgery, full body reconstruction. He really specialized in breast reconstruction at that time. So I really got to get hands on with anatomy, got to see anatomy underneath the skin, get to know it. An interesting fact about facelifts is you inject a type of lidocaine called tumescent fluid into the face before you proceed with surgery. And so he would have me doing that. So I got to know the feel of injection, the feel of the different planes, kind of my oopsie spots where the big old bruises will happen and things like that. So yeah, it was amazing experience. I would be doing that with him like 3 days a week. And then the other two, I would be doing the non-surgical things. And then it kind of went from there.
That's super amazing. So I think it's a very unique situation for someone like you because number one, you got into aesthetics when nobody was really getting into it. Now I feel like it's so overwhelming. Everybody wants in this field. One, it's a great field to be in. It's growing. We get to do great things for people all the time. But for you, I kind of feel like you got into it when nobody wanted to do it and nobody was using PAs, nobody was using NPs or RNs or anybody to do their injectables in the office. So you really kind of came into this whole world um, with just like so much opportunity to grow. But I love the fact that you followed up with him and you kept on him. Like he kind of was like, all right, see you later, sent you home for the day. And I
Yeah.
think if you hadn't sent that email, if you hadn't been brazen enough to say, no, this is what I want to do and followed up with him, you might not be in the position you're in at all. You may have just been like, okay, this isn't for me. Um, so that's huge. The other thing I love is that you did surgery with him. So a lot of people do cadaver courses, and
Hmm.
I don't, I don't discredit cadaver courses whatsoever.
For sure.
I've been to one. I plan on going to another this fall in December. But you and I experienced a different world in that, while you were scrubbing and assisting and doing a lot of like the side work of, holding the retractors and doing this and injecting the tumescence. Whereas I am, behind the curtain doing anesthesia, but also, anesthesia, we're always peeking over and staring at things. We've experienced live anatomy. And I think
Hmm.
that's huge. Live anatomy is different than cadaver anatomy. And you're looking at a
Yep.
90-year-old versus a 40-year-old. And things move when you age, whether anybody wants to admit that. Arteries, ligaments, everything's different. And I know there's a couple plastic surgeons in the area that will let people come and scrub with them. And
Hmm.
I personally think if you can find somebody that will let you scrub in a facelift with them, invaluable education at that point.
Absolutely. I mean, even if you can get into, if let's say you are in the emergency department, but you can sneak into a couple trauma cases. I mean, facial reconstruction from the trauma aspect is wild. It's such a cool, it's a very unique situation where you have to reconstruct anatomy, right? So it's an amazing understanding of where things should belong.
Yeah. Yeah.
Um, and then really, I mean, I still remember to this day, I had unfortunately a young male who was in a biking accident, and the rim of his sunglasses, the bridge that goes in between the two, lenses, actually broke through the bridge of his nose and it went all the way down to his nasal ala, to his nostrils. And so his whole nose was exposed open. And again, Dr. Gayoso is an amazing surgeon, so he was able to reconstruct him and give him pretty much his baseline face back, if that makes sense.
Yeah.
But to be a part of that and really understand that anatomy and see the reconstruction process and the healing process, was just so cool. It was amazing.
Is he still doing anything in the hospital? Is he still doing reconstruction in the hospital or no?
He'll do breast reconstruction here or there, but unfortunately, we're not taking insurance anymore, so it's kind of on a as needed basis.
Okay. It's funny because Jess and when I started anesthesia in like 2013, I worked with her other partner, Dr. Benniger. I'm pronouncing that correctly, right? Yeah.
Yeah,
You look,
you're perfect.
I probably practiced a million times when I would see it. Like, hi, Dr. Benniger, I'm Valerie. I'm your nurse anesthetist today.
Right.
But
Well,
so,
everybody wants to talk. They want to call him like it's the wine, Benninger.
oh, yeah, it does look like Benninger.
Yeah.
Um,
He's like, I'm not cheap wine. Okay.
So I think I worked with him when he first came to St. Pete, like 2013, 14, 17, somewhere around there. And he was in the hospital primarily. And then he worked with another practice that I kind of like followed in behind him. And then he's been with Gayosa for a while now. And I don't think he was a partner when he started, but he's a partner now.
Correct.
Really nice guy. And I'm glad he's in that
So
practice.
sweet.
Yeah.
Oh my gosh, for me to work with two extremely humble, generous, and just even keeled, calm and cool surgeons is a godsend.
Yeah. So Jessica is like the exception to the rule, everyone. We always talk about how people are like thinking these like terrible situations where they're like, I can't find somebody to work with. And I don't, it's hard to find people that your like values match up with. And
For
like
sure.
even your practice matches up with, because I know I struggled always like finding that even keel of like, I worked with a lot of older plastics guys who
Hmm.
didn't see the future in like regenerative medicine and Sculptra and like everything else. So it was hard for me to bring those products in. So the fact that you're with like two guys like that are very supportive and very humble, they exist out there, everyone. You can find them. Our friends,
Absolutely.
go ahead.
Yeah, I will say, sometimes it's not just about being the best business partners, but just like, and this is going to sound so cliche or however it's going to sound, but work life partners, right? Because Dr. Gaiso never had a mid level like me before. He had somebody that was an independent contractor that came in and did the injections, but worked for various plastic surgeons in the area. And so that wasn't really like a cohesive partnership, right? I mean, they got along well and things were fine then. But when we became more like a partnership, um, it still had its struggles as far as finding balance, right? Like I really had to earn my keep and prove that I could grow the non-surgical aspect of the practice. I was learning all the different things before I was jumping onto the newest and the latest, bringing on board all these different devices, products, things like that. Like I was an Allergan only injector for almost 5 years, and I had to really grow within it and really prove that I could do this and build a sustainable, growing, successful practice before I really could bring on other things too. So there is a little bit of a grind there. It's not all fairy tales, but there was at least that mutual respect that we had for each other as far as I wasn't going to push him to do things that maybe I wasn't for sure about or comfortable with. And I think he was able to gain a little bit of trust in me because of that.
Yeah. Yeah. And honestly, surgeons are a different breed of human being. And Jessica can probably attest to probably how hard he was on her for a long time in the OR, and she probably lived under a very critical eye, if you will. Plastics is hard enough as it is, but then for a surgeon to be able to trust someone to close their incisions and see their patients post-operatively, it would probably be like them gnawing off their own arm, to be honest with you, because
Oh,
it's just hard to trust people, number one. Number two, it's their patient and their baby. So I'm
yeah.
sure there was a lot of growing pains.
Can I tell you, I still feel like I have Pavlov's dog's reaction whenever he's like, wait, let me see what you just did there. Let me watch that because he was so meticulous. And every throw I would make, I would like throw a stitch and you'd be like, back that up, back it up slowly, now more slowly, because I want to see exactly what you did. And my hand would just start shaking and I just start sweating.
So though she may
So,
have found her partner for her work partner for life, it was not without its painstaking bridge.
oh God. No, I'm pretty sure I lost like 15 pounds my first year working in surgery. Even down to like lunch breaks. He's like, "Are you going to eat all of that?" And I'm like, "No, no, I wasn't going to eat all of
Really not. I don't want that cookie over there that the rep brought for me. I hate those.
that." Exactly. So,
That's
yeah,
amazing.
it's been a long, fun road, that's for sure.
Yeah. Well, so tell me, how did the path to partnership kind of begin? So for everybody that's questioning, like, what does partnership mean? So Jessica is now, a business partner with her associates. So instead of just working for them or kind of, being part of the office staff, she's got more stake in the game, which she just elaborated how she's earned that stake in the game through her weight loss and her sutures and everything that she spent a lot of time she spent time curating this baby, let's say that. So kind of walk us through, like, when did you kind of see that path in front of you and how did you know how to even tackle that path? And this is kind of like for our injectors that maybe have been with practices for a while and they're like looking for that edge and a little bit more with their practice.
Yeah, I think we're really on the forefront of something really cool for our industry, especially for our PAs, NPs, and nurses out there. Um, Basically, what I learned over my years of having just Dr. Gayoso and myself in a practice was how to approach something that I wanted to do, bring on something new. Was I really had to find a very objective approach to things, right? So I learned to dive into numbers and I really learned to dive into business numbers, my own growth, office growth. I mean, things like that. I really, really tried to get a handle on it so that when I presented things to him, it really wasn't something that I felt emotional about, even though I obviously did, but it could just be very objective, right? So I would set myself kind of different growth goals year over year. And he was used to that because of our yearly review. I would say, this is where I want to grow, this is where I want to be. But in return, this is kind of also what I'm looking for, right? Um, so we would always talk in 1 year, 3 year, 5 year goals. And so from the get go, I really kind of set, once I knew my non surgical practice was growing and it was growing into its own business entity, I set that goal at that 3 and 5 year goal of somehow being a part of the actual office, right? A part of the ownership, a part of um, the partnership and things like that. So I kind of let him know that's where my interest lied pretty quickly. So he literally, when he was ready to offer me that, I remember he kind of looked at me and he was like, "I'm ready to be your ball and chain." AKA, like, I know your next step is some type of ownership. And I know that if it's not with me, you're going to go do it on your own. And I think we see that a lot, right? Like so many people that aren't happy in their practices, that aren't thriving the way they want to be or being respected or have the autonomy that they want, they're leaving and they're opening up their own places. Um, so I think he was at least, he had the foresight in that was kind of, probably where I would go. But in the same sense, I didn't really necessarily want to go run off and open up my own place from scratch either. So I love being a part of a plastic surgery office. I love having the partnership between the non-surgical and surgical world. So for me, that was a best case scenario. Um, so yeah, that's kind of how it ended up. I would say probably I brought it up 3 to 4 years into working with him. And then about the third to fourth year after that conversation is when we really sat down and he offered it to me.
That's amazing. I think I love like where your head's at. Like your brain is one of those brains I just want to like get into and be like, show me the way, Jessica, show me the way. But like One thing Brandon will always harp on all of us about is knowing your numbers. Like, even if you're working for
Hmm.
someone, if you're on your own, like, you have to know your numbers and you have to know your value and your worth in that business and that business model. Like, what do I bring to the table for you and what can you do for return or for me in return? And I
Hmm.
think you did a great job of presenting that to them in the way they wanted. And also on their end, and a rep said it to me one time, and I'll never forget it. She said to the plastic surgeon I was with, who really kind of like the med spa side of things was just like it was an afterthought. Like, it's fluff, it's in the business model, it makes little money, it keeps people in our doors. But her approach to him was, like, you're not going to operate forever. Do you want a part of your business to be supporting you in retirement? Wouldn't that be nice if you had two, three, $500,000 coming in extra in your pocket from someone else's work that you've kind of cultured and grown into this? And not saying like it's not like a taking advantage of situation, but if you have an ownership in that business, you're going to make sure it survives and thrives, because you have a
Hmm.
vested interest in it. And with Gayoso, Benegar, all of these guys, any plastic surgeon that it is, they're not going to want to operate forever. There is a
Hmm.
retirement in their site. So if they can foster that relationship with whoever, whether it's a PA, NP nurse, um, I think that that's such a good business move on their part, because they can walk away
Yeah.
from the business and it's in good hands.
Yeah, absolutely. I mean, it's really been a fun and interesting. Let's see, when did we start this partnership? So we announced it um, earlier this year, but we had been working on the actual partnership business model for another year prior to that.
Yeah.
So it's it's a lot. It's a lot to consider. It's a lot to take on. But in the end, it's so worth it, I think, for both parties. I mean, just like you said, like, Dr. Gaius and Dr. Benegar, they're not going to practice forever and they don't want to, right? And so, and even still, like, even when it was just Dr. Gaius and I, we worked our tail off. Like, I am the first to admit I'm a freaking workaholic if I need to be, even if I can be. I just love it. I love what I do. I can't say no. I love trainings. I love clinical hours. And I was busting my tail for a really long time. And so it was kind of like this year was our first year that we sat back and we're like, I can go on vacation. I can go on vacation. The practice is going to be okay because we have each other. Like,
Yeah.
we're truly like have each other. And Dr. Gaius is the same. He's like, I got to take my boys to Hawaii and not worry that the practice was like not going to be able to sustain itself, you know?
Yeah, and I think that's a real fear for these guys because usually when they go out of town, the whole office shuts down. Um, you know,
Totally.
any front office people are off, administrators are off, nobody's in house doing anything. They have to find somebody to cover their patients while they're gone because they'll operate till the day that they leave or the day before, and then it's, well, who's going to see them if they have issues, and then they have to find somebody to cover, and that's a big deal to them. Again, I think all surgeons take their patients like that's their baby.
For
um,
sure.
but to be able to leave your baby with someone else is like a different monster altogether. So I think it's great that you guys have that. Do you think that, so how has this affected, you've been with AMI for a while, you said 6 years with AMI
Yeah.
training. Has that affected your training? Like, is it going to impact? Do you think you'll ever give that up?
So, well, here I go with my terms again. So one of my terms, so before I was doing all of my trainings after hours, right? So I was like cruising through clinical, working 40 hours a week in clinic, and then doing however many hours during the week after hours for trainings. So once the partnership happened, it was a conversation that now the trainings become a part of the overall partnership. So I kind of gave up that as like a side hustle, side gig, and it became more of a group decision. So with that being said, I was like, okay, well then they're happening during clinical hours, right? I'm not doing 5 to 9 p.m.s anymore. I'm not doing like on my off hours.
Good for
So
you.
it's a good balance. Yeah,
Yeah.
it's totally a good balance and made me not feel guilty for leaving work to go do it. They know that they're reaping the benefit of it. So it's kind of now this guilt-free, nice little balance that we have. So yeah, no, if anything, I think the trainings are probably only going to get bigger and better and broader.
Good. That's amazing to hear because it's people like you that we want in the training realm. We want people that have a crap ton of experience, both, in cadaver, live surgery, and having used and touched so many products, threads, lasers, this, that, and the other. So, you're an asset to the training world. That's me crushing on you again, but it's the truth. I mean,
Well,
we
thank you. You could see me blushing over here.
keep coming with the compliments. It's fine. No, I mean, it's, like having had like such a bad training experience followed by your good training experience, like it's night and day. And we need those trainers that are not afraid to say like, hey, let me show you my little trick, right?
Yeah,
Because, there can't be threat. I mean, you and I are located very close to each other in St. Pete. Um, and I always try to say like, get with people that you can send people to. Like, I don't do threads. I don't want to do threads. Like, I'm not passionate about them. I personally don't like, it's not my thing. And that's
I
okay.
get it.
Nose job, like the non-surgical nose job, it's not my thing.
Hmm.
There's body stuff that's my thing. There's this that's my thing. So for me, like, I want to be able to say like, hey, if you want this non-surgical nose job, that's fine. Go see Jess. And
Yeah,
I know that like I'm going to send you to Jess, and she's not going to take you off of me as a Botox patient. She's not going to take you, like, she's going to do the job. She's going to take the referral, accept it, and she's going to move on. There's plenty of people out there to see. Um, but it's that, again, like we always talk like community over competition. Like if I
yeah,
have an occlusion or Jess has an occlusion or you need more Hylenex because your office is out, like, hey Val, I need more Hylenex.
exactly.
I think it's important to build that community around you. Not
Well, for sure. And even, yeah, in the name of aesthetics, right? So, like, more and more people are getting into it, and more people with little experience, right? So, we kind of had this talk last week at the AES conference. I was in an Allergan lunch, and we were still saying how Juvederm Ultra did a study and how lips are still like the number one filler that people are getting and blah, blah, blah. And we're like, I don't know. We're seeing less and less of the big lips. People are asking for more half syringes. They're kind of taken back by it. But we weren't taking into account all of the new injectors who are only comfortable with lips,
Yeah.
right? So I think that's still why lip filler is like riding really high because of all the new people that are out there that are just jumping on board with that because that's their comfort zone.
Yeah. Yeah.
Um, so I always think in my head, I'm like, there's no sense to ever have competition with people because just like you pick a certain restaurant because that's where you feel best, that's what the ambiance you like the most, their servers know your name.
Yeah.
Everybody's going to have their own kind of place that really resides within them and makes them feel their best. So you're not the person for everybody and not everybody's the person for you. So like we should all just have this really respectful playing field and know that we're all going to still create very successful practices and continue to grow as long as aesthetics as a whole is growing in the right direction. Right. So as long as we have people that are well trained, that are still continuing to seek proper training, that are building that community, I think then aesthetics as a whole is going to rise and it's just going to be bigger, better, and where it really should be.
Yeah. Yeah. I couldn't agree more with everything you said. I think that, I did a brief Titan talk on just like safety in like the office. And my whole thought was like, wow, there's just so many people new to medicine in general that haven't seen a person faint. They haven't had to deal with, somebody having, a seizure or, thinking about lidocaine toxicity or thinking about small things like that. They like, my background in aesthetics is very short. My background in like critical care medicine and anesthesia is very long. So like you, I'm like a safety person. Like, if I don't feel comfortable doing that, I probably shouldn't be doing that. Or recognizing your limitations. What do I need to train more? What do I need to read more on? Like, I know, like, I want more in live face dissections, which is just me. But, I've seen plenty of them, but like, I find value in that. Um, some people find value in reading and things like that. But, you know, overall, there's a lot of scary things that happen out there. There's a lot of really great things that happen. I think it's one of those you just have to remember, like, there's always going to be a bad surgeon. There's always going to be a great surgeon. There's going to be a bad nurse. There's going to be a good nurse. So you really have to just pick your providers very carefully. Um, and training is so essential. Like we say that
Yeah,
all the time in this group.
yeah,
So our group trains a lot together, but we're always doing something
I
on our
love
own.
that.
What do
That's
you?
awesome. See, when I first started, I was alone. Like I would sit there and be like, "Oh my God, Dr. Gay, so what do you think about this?" He's like, "I don't know." It's like, "I don't inject filler," and I'm like, "Okay,
Told
I'll
me.
figure it out. It'll be fine. I'll figure it out." And there was like such this competitive, like palpable atmosphere that it was like, God forbid you ask somebody and they're like, "Well, why would you ask that? Did you screw something up?" Or God forbid you use Hylenex. That was the first thing everybody would say is, "Oh, well, I never use Hylenex. I've never touched that." And it's like,
Oh,
girl, I use Hylenex every day. I love to like etch out all my little weird things that are happening and just get rid of it. It's my little magic eraser. I freaking love it.
I love
So
that.
it's changed. It's changed so much. And I'm just so happy that it's heading in this direction. And I think it's truly people like you that are creating this community on different platforms and in different ways. So I am so appreciative of it.
Yeah. Yeah. Well, we have people like you to thank because, you fostered my growth, my independence, my, ability to be like, okay, I can do this. I'm not. And I think like we trained on lips together and I was like so skittish about lips, which is funny because most people love doing lips. I didn't want to mess lips up. I was like, I've
Yeah,
seen bad lips. Bad lips happen all the time. How can I make them perfect every time? And not every lip is going to be perfect. We all know that. But I love what
yeah,
you said about the Hylenex and people that are like, I never use Hylenex. Blah, blah, blah. Those people, be wary of those people because it's like
yes,
when I was training in anesthesia, I wet tapped somebody doing an epidural. It was probably like my second one I'd ever attempted. I wet tapped her. I felt terrible. And I had one of my trainers, like mentors, whatever they're an CRNA already, and I was with them for the day. They're like, listen, if somebody tells you they've never wet tapped somebody, they're either A, lying to you, or B, they haven't been doing it enough because it's not a matter of uh, if, it's a matter of when it's going to happen to you. So
totally.
I think it's so great that you point that out because there are going to be those people who are like, oh, I've never had to do that, and you're like, oh, okay, whatever.
Please. I'm all about low expectations, and I will tell you because I've probably done it. I remember my first set of lips. This poor patient, she came and her husband bought her lips, and this was at like the time that Kardashians were thriving, like the big lips were thriving. And she was so excited. Her husband gave her just enough money to get one syringe. I didn't know any better. I'm like, let's rock this. It's going to be amazing. I did it. She looked in the mirror. She started crying. I
Oh,
was
no.
like,
Oh my God,
I was
no.
like, oh no. Well, she wanted Kylie Jenner lips. And at that time, I didn't know how to set the expectation of like, this is going to take multiple syringes over multiple sessions. And I remembered that was my first, like, oh dear God, what I get into
Oh,
moment.
yeah, and those are important moments to recognize. And like, how long ago was that?
I mean, it was my first pair of lips over
Yeah.
8 years ago.
So
Yeah.
it still lives in your closet, like lurking over you. It's like, Jess, don't remember that
Yeah.
girl you made cry.
I know exactly what exam room we were in. I know what she looks like. I remember everything.
Oh God. Yeah, we've all had those patients that were like, shouldn't have done that. I did it, Lord, and
Hmm.
I shouldn't have done it. Oh my God,
Yeah.
that's
Yeah.
well, we're at our like 30-minute here. We did not unpack nearly as much as I wanted to. We could probably do 5 more podcasts together on just her experiences, her training. I guess, always our closing caveat that we'd like to talk about is like, what's your best advice for people trying to get into this? Because they want to know, like, they want to get into it, they want to know how to, and, what do you have to offer them as advice?
For sure. So I definitely think, unfortunately, a lot of these trainings out there cost a mortgage payment. And so I, I'm, I'm not a big fan of that right now. Only because it does limit people who are really trying to get in, right? You could have all the passion in the world, but not the money to pay for these trainings. So I think that's unfortunate. So for me, I definitely, you know what I kind of thought of that I think would be interesting if somebody tried this is go to your local, even just community college and take an anatomy course. Like
Ah,
dive in that way. That would cost a fraction of the cost, and you can do different cadavers. You can do so much of a deep dive into anatomy. I definitely think as somebody who is hiring, you want to see that a person is invested in it. So I think investing smartly is the way to go. You don't have to go do the flashy trainings, but some of your local trainings I think are best. But reach out to your local companies. Reach out to Allergan. Reach out to Galderma. Network as much as you can. Join your local PA associations and things like that, and just network your tushy off. Because truly, this world is a lot about who knows who and timing of things. So often, it's the filler reps that are actually helping offices find new employees. And I will say, as a little flash of hope, more and more offices are looking for that green injector because they want to mold them and they want to grow them their way. Where in the past, they were really looking for people that had a ton of experience and a following. I'm seeing a little bit of that trend change to where if you just have that drive, you have the fundamentals of being a good human, right? Being a good customer service person, but also having the passion to really put into your own business. Because no matter what, even if you're working for somebody else, this is still your own business. You have to grow your clients and you have to maintain your clients. Um, so yeah, I think a lot of it just has to do with networking and getting to know people and just kind of putting yourself out there.
yeah. I mean, and it's hard. Like it's hard. Like even as like, I mean, I've been injecting in a couple different places since 2018. And even now that I'm on my own, like I don't have the big account with the reps, so like I'm very careful with who I curate a relationship with. What are the benefits of being with the company? How can the rep help me? How can I help them? Like it's kind of a very like you said, you have to network with these people, let them get to know you, let them know, the playing field that you're on. I'll tell you, reps will poach people all the time from offices. I've had them poach me. I've had them try to poach me. But they're a good resource of like, hey, who's hiring? I
For
think that's a
sure.
really good point to make because like with you, like you might be training somebody, um, and or like any rep is in an office training multiple providers, and they'll be like, "Hey, are you looking for something more?" And that's what my Galderma rep was flat out like, "Hey, are you looking for something more than this? I think you'd be a good
Hmm.
fit with X, Y, and Z because they know who's hiring out there." I love the idea about the anatomy class. Um, I even tell people, I'm like, buy a facial plastic surgeon's book. Like,
For
start flipping
sure.
pages, looking at the pictures. Like, it's that, 2D model that we need to get in our head of where things are supposed to lie at. Might not be there, but,
Yeah.
anatomical like, creations are there. Um, and I just think it's great. I think it's great what you're doing with Gaioso. I'm like so proud that a PA is doing this. Like I kid you not. Like when I saw that on Instagram, I was like, she's doing it. She is doing the damn thing, people. And I'm so
Well, thank you.
and I mean, she has worked her way up to this. Like, don't anybody like discredit. Like, this is a lot of work in this field. She told you 8 years to get where she's at. You can get there too, but
Mhm.
it'll take a little bit of work on your end.
Totally. You got to keep grinding. I mean, it's trust the process and just keep trying to be better and better, but also be honest, Be honest with yourself, be honest with your patients, and I think that's the best way to kind of grow.
Yeah. So in closing and wrapping things up, how can our listeners find you if they want to do a training with you or if they want to reach out, do like a shadow day, mentorship, anything like that? How can they find you on Instagram and your email, social media, all those things?
Yeah, so we actually, funny enough, have had the discussion lately about doing shadow days because I really think beyond the big flashy trainings that you do for 8 hours and your brain is completely mush, shadowing people, because seeing what the day to day in aesthetics is like is to me like everything, because everybody thinks it's this big flashy world with all these flashy people and everything's glamour, but like
Well,
go shadow for a day.
snacks around and coffees, driving a Porsche, like, no, that
Yeah.
is real life, guys.
Yeah, exactly. You are everybody's therapist. You are everybody's dream maker. You're their highs, their lows, and everything in between. So, we are actually going to start like a daily shadowing program where you can come and shadow for the day. So you get to see not only injectable techniques, but also just what the flow of the day is and what a day in the life is. So please reach out to me. You guys can reach out to me on Instagram. I'm Jess McCarry Aesthetics. You're welcome to email me. I'm jmccarry@drgayoso.com. You can call the office. I'm cool with that too. 727-895-1515. This is my infomercial. But yeah, any which way you can reach out to me, I'm totally available to
Jess is
anybody
so
and
laid back.
everybody.
Jess is like, if you want to show up to my house, that's great. Also, this is my address. I usually wake up she's probably like a 4 a.m. riser. I'm on my Peloton. Just let me
Totally.
come in, ask me questions. I'm here
Yeah.
for it. She's a great
I
open
swear
book.
my dog's friendly. Yeah. Yeah. No, I think that's what it's all about, right? It's just creating this open dialogue of everything. And I think that's just going to make the aesthetic world just that much better and more enjoyable, right?
Yeah, I agree. Couldn't agree more. All right, guys, we're going to wrap up this week's episode of the Aesthetics Injector Gang. Jess is part of the gang now. She didn't know it, but she's
Woo!
in there.
Woo!
We're so happy to have her on and kind of just hear everything about what she's had going on, where she came from. I think this is great. If you guys are looking to contact me, I am Injector Valerie on Instagram, spindriftbeauty@gmail.com. If you have questions, you can always reach out to anyone in the gang. We're here for you, and we look forward to hearing from you. Bye.
Thank you. Bye.
Thanks for listening. If you enjoyed this episode, please like, share, and comment. Follow us on Instagram at The Aesthetics Injector Gang.